Now it's time for our brainstorming discussion. I request active participation of all the delegates.
I am a registered nurse in Japan, and I'm in Tamil Nadu, Pondicherry. Maybe you have heard about Oroville. Oroville is universal town, and I'm given acupressure for village people, and also learning naturopathy and Ayurveda whenever I can. And my basic idea is people should enjoy their life whenever, like in any body condition, any health condition. It's my basic idea, and I have planned to start holistic medical hospital, maybe in Japan, as well as natural farming, because nature, if all of you already know, nature itself has healing energy. So I want to start with natural farming and holistic medicine together. But also I really want to encourage people and educate people more. So preventional medicine has to be included. And also my research in Japan was about suicide, because many people committing suicide and dying, like 30,000 in Japan, and even in India, like 50,000 to 100,000 people died, and all over the world it's million people. So, many diseases, maybe sometimes it's hard to prevent, but suicide you can prevent. So I really focus in prevention and encourage people to live with dignity. So dignity care, maybe you have heard about it. So I want to collaborate with really internationally as global health about mental health and holistic medicine. Thank you.
Good evening to everyone. My name is Liliana Domingos from Portugal. Interesting to hear you, because in Portugal I'm saying we because it's me and Susanna that's not here right now, but we are starting to run a project that is related basically on Ayurveda, but we want to integrate modern medicine with TCM and Ayurveda, and we want to create there a kind of special farm as we call it, and there with some center for well-being and hospital too, that integrates these two, it integrates health in a holistic way. We would like to work mostly mental disorders, okay? Because suicide and depression and all of this is a big issue, mostly in Europe. And but we were working on this thing of Horizon 2020, and there are some things that I would like to share, because we've been studying this. I didn't saw the beginning of the presentation, but what we study about Horizon 2020 is not so easy to go along with the project to answer a call. Call is the item where we propose. So we know, for example, at this moment, there was a deputy that wants to put a German, Angelika Nieber. It was a European deputy that wants to put CAM on Horizon 2020, but it didn't went through. So at the moment, there's no possibility to present a project that has CAM by itself to be financial by European Union. The 2 points that could CAM work are on the proposals that is establishing effectiveness of healthcare interventions in pediatric population, and also promoting mental well-being in aging population. These are the 2 points where these issues or CAM could be introduced. This is for 2014 and 2015. Maybe for 2016, the issue of CAM, promoting CAM, can be introduced by itself. But at this moment, it cannot be in that way of CAM. So we would like to work in a way that, for example, a project like this, mental disorder, well-being, whatever, that can at least are being looking by European Union as priorities, that can be financed in a way. So it has to be studied in a way. If someone here wants to really go along to create a project relate with this and make it as financial Horizon 2020, it has to be looked in this way. Okay, I don't know if you understand more or less the message that I want to pass, but are these main issues mainly to people, senior people? It's now the attention of Horizon 2020 and European Union. Okay, so all the projects that could go along with that would be possibilities of financial. Okay, thank you.
We are doing therapies for them, which is working on certain points on your head, which is called as axis bars. So which we have learned and we are practicing that along with essential oils and flower essences with session practices. And we have seen that these people are losing fat from their body very easily even after eating food which is not the typically healthy food, which really surprises me also. So we don't know the scientific aspect of how it is happening. Just with the flower essences, aroma oils and the therapy called as axis bars, they are really losing fat cells from their body. I have a machine which measures the fat cells. It shows the fat loss. They show in the body inch loss. So I would be open to see if there's anyone who can associate and help me figure out what actually happens at the scientific aspect, so that I can actually take this as a study and take it forward at a different level. And along with what Sachin added, as he said, we have depression clients, we have a lot of emotional issue clients who come to us who have been on psychiatric medicines maybe for 6 to 8 months but not seen results, or also patients who have not gone to psychiatrists and have directly come to us. These people are again with these 3, 4, 5 combinations of therapies that we are doing. He's also into crystal therapy. We do some energy healing work. We do essential oils and black flower essences and the therapies that I just mentioned. We see that just with 4 or 5 sessions, there's almost a recovery of severe depression cases as you spoke about suicide. These are people who call us just at the verge of suicide. Like if we don't give them an appointment, they're going to commit suicide. That's the level at where they are. And they come back to us just at the end of 2 or 3 sessions. They come back to us almost 80% recovered. And we have been lucky enough to have good associations with our clients who have been with us. They have always been with us. So we have also tapped how they are doing in the past 1 or 2 years. It's not that we just treat them and then we leave them. We don't know what's happening in their life. We know of them from the time they have come to us till date. It could be 3 years, 2 years, or whatever number of years, and they are doing still good. So again, if anybody would be interested in taking these things ahead and where we can work on what biochemical changes are happening and how things change, because obviously yes, just the counseling also doesn't help here. Because these are again people who have undergone a lot of counseling, and the first thing they come and tell us is, if you're going to counsel me, I'm not coming to you. So we can't talk to them a lot. So again, it's not counseling. So it's something beyond that. So I'd be really thankful if anyone here can associate and help us to take this to a different level. Understand, I was so amazed with the kind of researches you all have done here. So if someone can really help us to take it to that level, either guide us or tell us what is the step and can help us with a lot of the seniors here are into all of these work. So we will really be thankful if we can take this and present it as a case study, because we do have the physical aspect, we do have the emotional aspect, we don't have the internal studies to show about what exactly is changing with it. So would really appreciate if anyone would like to collaborate. Thank you.
My name is Meghnath Verma. I'm a BNYS graduate, naturopath graduate, and currently I'm doing MD from S. Vyasa, Swami Vivekanand Yoga Anusandhan Sansthan from Bangalore. So I came for my institution only because my institution having a big research lab nowadays. They have the biomolecular research lab, they have neuropsychological research lab, they have genetic research lab also, and they are doing research especially on yoga and different diseases. They had research paper on cancer, mental health patient, and diabetes. They are doing the stop diabetic movement in the national level. So anybody can, if interested, so you can contact the Swami Vivekanand Yoga Anusandhan Sansthan. We have facilities, but we need funds for research on yoga, effect of yoga on genetics, effect of yoga on biomolecule, effect of yoga on neuropsychology, all these things. Thank you.
My group is specifically working on breast and cervical cancer, wherein we are using Ayurvedic medicines, medicinal plants, making herbal formulations. We are even working on nutraceuticals, and I am also working on nanotechnology-based approach where I am conjugating anti-cancer drugs to magnetic nanoparticles for targeted drug delivery. And I am also working on herbal bioactives, conjugating them also with the magnetic nanoparticles. So we have made two formulations, one on cervical cancer and one on breast cancer. We do all the in vitro work, we on cell lines, we do all the molecular mechanisms. What you were saying, all the biochemical aspects, means molecular biology, signal transduction pathways, everything we study. In vitro means in cell lines, and then we have mice models, we develop human mouse tumor models, and use these herbal formulations orally, we give the oral garbage and see whether it's having the anti-cancer activity. So we are not omitting cytotoxicity, what you said. Cytotoxicity doesn't mean it is anti-cancer activity. We work in dosages which are non-cytotoxic. Means at non-cytotoxic level we show all the molecular mechanisms which are undergoing, which are showing the anti-cancer activity. So we propose that these herbal medicines should be used as an adjunct to chemotherapy, which may reduce the dosage of these chemotherapeutic drugs, because we have seen that these are anti-cancer, plus they have immunomodulative properties, plus they do not kill the normal cells. That's all. So anybody interested can.
So what are the nanoparticles you are interested in now?
Magnetic nanoparticles, Fe3O4, because they are shown to be non-toxic, they are being used at clinical level as well. Then gold nanoparticles using medicinal plants extract, because that is also non-toxic.
So have you have any, you program or any multi projects with different countries?
No, not as yet. I have done everything in Pune with my collaborators. So I'm interested in whatever you feel.
Thank you.
How do you work actually, like in collaborations or in vivo experiments? Is it like
in vivo we do at our own place. In vitro, in vivo, no collaboration. Only nanoparticle based I have. Physicists and chemists there.
No, suppose if we want to collaborate for in vivo,
Okay.
how it's going to be? It's like the MOU kind of thing.
Yeah, MOU and funding. We will have. Funding is the main issue nowadays.
Okay.
Funding is the only main problem.
So if the funding is there, so then you are ready.
Then I'm running.
So you have all the
Yeah.
facilities.
Do you have funding now from DBT?
DBT projects, yes, but right now DBT is also having financial crunch. Also funding
They sanction,
everything.
but they don't release the money.
They just say it's sanction, but they don't give them.
Yeah, all have a sanction, plenty, but they
So,
don't release.
all 2 years have passed, we are not getting any money.
Yes, difficult now. Thank you, madam.
Yesterday I was absent just because of the festival. I am from Lucknow, retired as a professor head in 2004. I had been involved in research, teaching, post-graduate teaching, PhD for 37 years. Now I am doing one very important work borrowed from Sushrup, that is non-invasive surgery. I will be presenting tomorrow that program. and I appeared in Harvard University. Professor John Reed, he accepted this program. Just I wanted to advance this because certain technologies they are required. Medical engineering is required. So I went there. They accepted in principle, and they had advanced my program for the American funding. If that funding is accepted, certainly we will be doing much more things. Minimal invasive surgery. This is what I would like to present tomorrow. That is non-invasive surgery. Because you know there are three elements for surgery. That is bleeding, pain, infection. There is no bleeding, no pain, no infection. I present. If anybody wants to associate with me, I would rather welcome. Thank you very much.